Welcome back. I hope you all had great discussions, and thank you so much to the presenters for sharing your work. So exciting. I am fortunate and honored to have the opportunity to have the last word here, I guess, to provide some brief closing remarks. And to start this off, I'd like to just begin with a few reflections on the meeting. First of all, how exciting to have so many presenters who are new to HARC and new to this meeting. Several of you are early career or new to home visiting, and we really value that you were willing to step up and share your valuable research and perspectives so that we can all continue to learn from each other. So thank you. I'll just share a few reflections of content and some of the conversations, focusing on key themes. Just to start, the presentation on coordinated state evaluations was a great example of what can happen when folks come together to think deeply and work collaboratively to address common challenges. Equally exciting was hearing about plans to center families and home visitors in the research process. Other breakout sessions gave great examples of how concepts of precision home visiting can be applied across a range of topics, from father involvement to family economic security. I was not able to be in 3 places at once yesterday, so couldn't attend all of the breakout discussion sessions, but I did hear about some rich conversations that took place. For example, in the discussion breakout on incorporating a diversity, equity, and inclusion lens, we talked about the need to be careful and deliberate in our approaches to equity and inclusion, and that this should not be rushed, but should be developed with consideration of the rationale for it, the goals of it, the context, and the critical input of parents and providers. We also talked about how measurement of constructs such as race is incredibly complex, and there's a need for much more work in this area. The breakout group on the precision paradigm talked about the potential for using the paradigm in workforce studies, and how although this feels challenging, it is necessary for promoting understanding of how to align professional development to best meet the needs of both the home visitors and the families with whom they work. The breakout group on technology discussed how hybrid home visiting is here to stay, and that we need research to understand what modes of delivery work best and for whom, the whom being both home visitors and families. There was also discussion about new types of technology that might be out there in the universe that have potential to be useful in the home visiting context, either for the purposes of service delivery or for assessing outcomes. And certainly one of the overarching themes that we heard was the need to incorporate family voice in research, with emphasis on including families not only as participants, but rather leveraging parent and caregiver expertise in how we develop questions, how we design research studies, how we collect data, and how we interpret and share the results, and how ultimately this will lead us to findings that are relevant and useful for advancing the field. Of course, I could list many more, so feel free to share any additional takeaways or insights of your own in the chat. As Anne Duggan described in the opening session, our current charge, or HARC's current charge, is to build awareness, opportunity, and capacity for research-informed policy and practice. I'm going to focus the remainder of my closing remarks on opportunity. We are now nearing the end of our current 5-year funding period, and many of you are aware of this because we reached out to you for help shaping our vision for the next 5 years. While we are optimistic about our proposal for future funding, we never take anything for granted, and we believe the future is bright as long as there is a strong national research and development platform for home visiting. What many of you may not know is that I was a member of the very first cohort of HARC Scholars back in 2013, when HARC was called by a different name. I like to think that that investment in me was a worthwhile investment, and I am grateful for that opportunity and for the mentorship that I received from HARC. And I personally am very passionate about paying it forward to the next generation. And today, I am honored and humbled to have the opportunity to work with brilliant and like-minded people who are so passionate about the work that we do as researchers and evaluators, meaning all of you. What gets me most excited about HARC, first and foremost, is the opportunity to bring together and engage everyone who cares about and stands to benefit from home visiting research. So not only researchers and evaluators from diverse disciplines and types of organizations, but also models, states and tribal organizations, program staff, policymakers, TA providers, and of course, families and communities. There are so many opportunities for mutual learning. And second, I'm excited about the opportunity to support those of you who are engaged and invested in research to do the things that get you excited. Everyone has a role to play and something to contribute, and our role at the Coordinating Center is to facilitate this work in whatever way we can. We know we can achieve more when we collaborate for impact. So we hope you have heard in this meeting about some ways to get involved, and we anticipate reaching out very soon with opportunities to engage in further conversation. But on that note, I am going to actually hand over the virtual podium to Cynthia Minkovitz, a colleague who is going to share an update on one more up-and-coming opportunity. So Cynthia, I will hand it over to you.
Great. Thanks so much, Allison, and greetings, everyone. And thanks for sticking with us till the end of day 2. So last year at the annual HARC research meeting, we announced the availability of a new NHLBI mechanism known as Enrich, early intervention to promote cardiovascular health of mothers and children. Since then, HARC provided technical assistance to multiple clinical center applicants and also submitted a proposal to be considered for the Resource and Coordinating Center. Today, we're pleased to share an update with more info to follow. And first, we want to recognize the efforts of multiple federal partners who will be supporting this effort, including the National Heart, Lung, and Blood Institute, the Administration for Children and Families, and the Health Resources and Services Administration, along with the National Institute on Minority Health and Health Disparities, the National Institute of Diabetes and Digestive and Kidney Diseases, the Offices of Behavioral and Social Sciences Research, the Office of Disease Prevention, and the Office of Research on Women's Health. Next slide. So Enrich is going to support research to test the impact of interventions to promote the cardiovascular health of mothers and children. And importantly, from HARC's perspective and all of us on this call, it's testing interventions in the context of home visiting to not only promote maternal and early childhood cardiovascular health, but to address really well-known and longstanding disparities. So this is really an incredible opportunity. First, it will tailor interventions to diverse populations that we've spoken a lot about in the context of the last 2 days. And it will enable the researchers to test what works best for whom and under what conditions, again, as well as addressing health equity. It's anticipated that funding will last over 7 years, with the first 2 years being planning, pilot, and feasibility studies across the clinical centers, and implementation over 5 years. Now, as many of you know, it takes about a year from the time of submission of proposals to the start of large initiatives, and Enrich is no exception. So the start date, the best I can say is it's very imminent, and we can't be more excited to see what the field learns together. Next slide. NIH expects that 1 resource and coordinating center and up to 7 clinical centers will be awarded, and again, announcements will be in the very near future. And across the clinical centers, we expect that different evidence-based home visiting models will actually be participating. The clinical centers will have a lot of important roles, including proposing and designing trials during the first phase to implement during the second phase of the project, conducting feasibility and pilot studies, promoting community partnerships, enhancing and supporting staff skills and development, and taking part in developing a common flexible protocol. The coordinating center will be supporting the clinical center's activities and a variety of other data-related activities, some of which we've spoken about in the last 2 days, not only around data collection, but also maintaining a central database, analyzing the data, and reporting on both process and impacts. Next slide. With respect to some of the key features that we all can anticipate from Enrich, importantly, the studies will be conducted in under-resourced communities, families who might be living in low-resource rural or urban areas, and geographic areas with very high prevalence of cardiovascular risk factors. These could include, pregnant persons with diabetes, obesity, preeclampsia, and a host of other factors. And the interventions will have many exciting features. It will focus on mother and child pairs or dyads. It will also be delivered via home visiting, but in combination in all likelihood with virtual service delivery such as mHealth and telehealth strategies. And importantly, in building on conversations again that we've had in the last 2 days, the intervention will really encourage partnerships and integration with other service systems, which we know is so critical for effectively connecting families to services that they are eligible for, desire, and value. So it's anticipated that each clinical center will enroll 500 to 600 dyads over the course of the study. and that the study will assess maternal cardiovascular health outcomes that align with the American Heart Association's Simple 7. So these are lifestyle changes that'll do things like managing blood pressure, controlling cholesterol, reducing blood sugar, helping young parents become active, eat better, lose weight, and stop smoking, things that we know are evidence-based lifestyle changes that reduce cardiovascular health risk. He also will assess trajectories in infants and children aligned with the American Academy of Pediatrics Bright Futures efforts. And there'll be a rich body of information that emerges to provide evidence for implementation strategies across diverse families. So in effect, we expect Enrich will provide strong evidence for causal inference, as well as strategies for implementation to inform all of our work to use home visiting as a service delivery platform to promote cardiovascular health equity, again, across diverse families. Next slide. Enrich will also have the opportunity to use the precision paradigm as it specifies the various features of the intervention that the clinical centers decide to implement. So shown here, it should be familiar to many by now, as the precision paradigm, which has been adapted from the work of Mickey and colleagues. And as you've heard over the past 2 days, this paradigm is a work in progress. The paradigm highlights that interventions are comprised of techniques and methods of delivery, and that their specific interventions can aim to influence mechanisms of action, factors to build motivation, capability, and opportunity to again promote those target behaviors that we think will improve cardiovascular health outcomes, both for mothers and their children, and thinking about developmentally appropriate trajectories. Enrich will also need to consider the context, and we've spoken a lot about that in the last 2 days. How do we measure it? How do we conceptualize it? How do we collect data about context? What's the variability in study participants? The staff will be delivering the interventions, the home visiting models delivering services to families, and the assets of communities are just among the few contextual factors that will be really important for the study team to capture. And we also expect that actual uptake of the intervention and the context will moderate a lot of the important relationships that ultimately may lead to the desired outcomes. So in effect, Enrich will expand our collective thinking about what works for whom, in what context, why, and how in promoting cardiovascular health. Next slide. To give a flavor of how the precision paradigm might inform the work of Enrich, mapped onto the paradigm are examples of context, usage, possible interventions, target behaviors, and ultimately outcomes. Now, these are a sample of many possible examples with many more that the Enrich team might consider and test. But we can look at interventions and think about virtual delivery, linkaging with primary care, or digital or mobile tools that might be used. We can think about target behaviors as being those lifestyle factors in Life Simple 7 for adults. And we can think about outcomes as being composites of cardiovascular health metrics, both for mothers and their children. You can continue to read on the slide some additional possibilities. Next slide. So in sum, there are many novel features about Enrich that we're very excited about. So Enrich provides an opportunity to promote health equity and cardiovascular health, all within the home visiting context and linked to home visiting services. It promises to be a cross-model study that builds on the best of what multiple home visiting models have to offer, and again goes beyond the boundaries of home visiting to think about new methods of service delivery. It has the potential to align with the precision paradigm, and importantly, Enrich, because it's required in the guidance, and I'm sure is probably in all likelihood and top and foremost on the minds of all who ultimately will be participating, Enrich will have a strong commitment to advancing awareness, opportunity, and capacity for early stage investigators and home visiting staff. And it's a theme that Allison noted and really started and was a thread throughout the last 2 days. So the best I can say right now is stay tuned for further information. I know that there are many who eagerly await announcements, as do we. And so we'll be sharing updates as information becomes available. So I'll turn it back to you, Allison. Thanks so much.
Thanks so much, Cynthia. Wow, what a lot of information and an amazing opportunity. And I'm sure many of you have questions, and I know we are all eagerly awaiting more information, and we'll find ways to share information and answer questions as soon as we know more. So on that note, I'm going to end by just sharing a few more opportunities to engage with HARC. As mentioned earlier, we are upgrading the HARC website to increase audience engagement, and we'll likely be reaching out to some of you to involve you in that process. But in the meantime, we have produced many new resources since our last meeting that we hope you will check out. These include several research briefs that describe work building the precision paradigm, research on emerging issues, and precision approaches to coordinated state evaluations. We also have links to quite a few new publications describing research that addresses critical issues in home visiting, such as those listed here. Of course, these are only a few examples. And also, as John mentioned earlier, a new toolkit for local programs to use to promote responsive partnerships with families that is grounded in research that included engagement of local home visiting staff. Lots of new things on the HARC website. Other ways to engage, be sure to read our newsletters and engage with us on social media. Leverage the power of our practice-based research network, conduct your own research. Please be in touch. Contribute your expertise by participating in research or joining research or evaluation advisory boards that we often advertise through HARC. We are also exploring ideas for special topic meetings so that we can come together more frequently to discuss emerging issues, and we welcome your ideas on those. Help us build capacity for research, especially among early career researchers. Be a mentor. And finally, we are eager to hear your ideas, so please work with us to identify needs and develop new opportunities to build research capacity. We need and welcome new and diverse perspectives. And so here is where we end. On behalf of the HARC leadership team, I want to thank everyone who participated in our meeting today, including participants and also presenters. We could not have pulled this off without you. Also, a huge thanks to Kay O'Neill and everyone at the HARC Coordinating Center who organized this meeting and did a great job. And of course, our National Advisory Committee and funders and partners at HRSA and ACF. I also want to remind folks to take a moment to complete the survey that will arrive in your inbox tomorrow. We really want your feedback on what went well and how we can improve in the future. So please remember to complete that survey. And thank you for doing that. With that, we will bid you a good afternoon. And again, thank you all. This was a really exciting meeting and just really appreciate your participation. Thanks.